Glad to have you joining me this Saturday morning on Doc Talk. I'm Dr. Jeffrey Gallops, and I am here to help you navigate the changing healthcare landscape and environment. Remember, it's your health, your money, and your choice, and we're going to have to be better consumers of our health care dollars. When we spend our dollars, how are we going to spend it? What are we going to do with those dollars? And we need to realize that there are alternatives out there that we don't realize. And I'm glad to have on the show today Dr. Taz. Tasneem Bhatia. Glad to have you, Dr. Taz.
Thank you for having me. I'm excited to be here.
Are you excited about how cold this room is?
I'm never excited about how cold the rooms are. I forgot to bring my parka this morning.
It's a meat locker.
Vicky, like you've been in studios all your life. Why are studios so cold?
Because boys like cold temperatures. I have no idea why.
No, it's because we have to make sure the equipment is nice and
Thank
cool.
you, Alfie. That's what a good producer does.
Look, if
like
this board,
Alfie, he's making sure
right.
the board's
If it's too warm in here, Vicky, then we can't put a show together. And then
but
we're
the
denying
icicles on it are damaging it as well.
But look, it's okay.
Well,
I have ice for my water.
Well, I'm glad all of you are here to join me on this Saturday morning. People often ask me about operating rooms. Why are they so cold? It must have something to do with keeping the bacteria count down. But that's not why. It's because we surgeons are wearing all that garb and the nurses are wearing all those protective clothing, and it's hot under there. That's why operating rooms are cold. How about that for a tidbit of useless information? It has nothing to do with the bacteria.
The more you know.
It has nothing to do. It's good
Every
to
time
know.
you listen to the show, you
Good
learn
to
something
know.
new every week. So it's amazing. You're doing a great community service, sir.
Thank you. Glad to do it. And I am so glad to bring Dr. Taz to our show because you might have seen her on any number of television shows, but in particular, Dr. Oz. You were on the Dr. Oz show. Saw that segment.
I have been on the Dr. Oz show. We've been on a couple of times.
And you're an author. You wrote a book, What Doctors Eat. We want to talk about that because I certainly have some eating issues. Vicky loves to point out my carb phobia. You're a nutritionist. You're an assistant professor at Emory, and you're the medical director of the nationally recognized Atlanta Center for Holistic and Integrative Medicine. But even more importantly, you're a mom.
I am.
You're a mom of 2 children, a boy and a girl. So how do you do all this?
Well, it sounds like a mouthful, but it's everything I love and everything I believe in, quite honestly. And it all came about really slowly and over time. I started, as a conventional medicine doc. I was an ER doctor for at least a decade before I started the center, and really just got into this because of my own health issues. And so everything that you just read out is me trying to put the pieces together, trying to put all those pieces of my health together, which then resulted in the center and the books and the nutrition counseling and everything else.
So what was your life-changing experience that led you to leave traditional mainstream medicine and move toward holistic?
Well, you might be able to relate to this. We're sort of, going through residency and going through med school is kind of like boot camp, right? They break you down and they build you back up. So in that process, though, I had no consciousness about my own health. I was completely unaware of the fact of how sick I was and went directly out of residency into an ER, job and was working full time in the ER, much like what you're probably doing.
Sure.
It's long hours, night shifts, early shifts, day shifts. You're all over the place. And was just getting sicker and sicker and sicker. And so started going to doctors, went to the best doctors in the city, traveled outside of the city to get some answers. And no one could really give me options that worked. A lot of them were medications that I had horrible side effects to. Some of them were surgical options that I had no desire to do. So I kind of took things in my own hand and just started studying.
It sounds like you became pretty ill.
I did, and it's all relative. I'm still, when I see patients today, I wasn't nearly as ill as some of the people I see now, but I mean significant fatigue, hair loss to where it was visible, a lot of really bad acne, a lot of hormone irregularity, to the point that it was affecting fertility. A lot of those issues that many women today struggle with, and the options that I was given were not things that I wanted to do or I tried to do. And then, my favorite story, or my best story really, my defining moment, was I was put on a particular medication which lowers your blood pressure. It's supposed to help with hair loss. Took the medication that morning, went off about my business to go on my errands, and it dropped my low blood pressure even lower. I almost passed out while driving and got into an accident. And so I could have died in that. So, then I just looked at the stuff I was doing and I was like, this is not working. So I started studying, and that's what led to all this stuff. And one thing led to another.
Well, you've become an inspiration for so many people because people are looking for alternatives to traditional medicine for multiple reasons. One is the cost of the current system, and if I'm going to spend my money, then maybe I'm going to find something that is maybe non-traditional, that may be even less expensive. But ultimately, being healthcare consumers, we want the best thing for us, and society is moving us that direction. What are you seeing among your patients with regard to their changing attitudes given this healthcare environment?
Well, here's what I see, and here's what I hear, more importantly, from patients. They're just frustrated. They're completely frustrated with the current medical climate and the current medical landscape, and they want options. Right. And the frustration, the frustration comes from, first the criticism of alternative and holistic medicine was that it's expensive or it's for certain people only. But, honestly, nowadays, even the cost of our regular medications and medications for chronic disease is significantly high. I had a patient tell me the other day that one of her medications for her rheumatoid arthritis was $800 a month. Insurance was not covering that. So we don't really have an option other than to expand what we already know and seek other remedies that are in the long run significantly cheaper. I can't count the number of patients. I think we've seen over 5,000 or 6,000 patients now in the practice. Wow. I can't count the number that have gotten off their prescription medications and are managing their diseases through diet, maybe a couple of supplements and lifestyle modifications.
Well, that's inspiring, no doubt. Once again, we're talking to Dr. Taz. She is medical director of the nationally recognized Atlanta Center for Holistic and Integrative Medicine and is nationally known. Always glad to have somebody local here in Atlanta who's making an impact, on the nation, if not the world. So you've been able to get people off medications, and I tell you, our listeners, they hear this and they want to know, how do you do it? I mean, where do I get started?
Well, this starts with a lot of what you're discussing and focused on. The future of medicine is personalized medicine, individualized medicine.
That's the way it should be.
The reason we're successful is because every person is an individual, and we're really after finding out what their individual issues are, and then you tailor anything you're doing to that individual, not to a huge group in a randomized, double-blinded, placebo-controlled study.
Sure,
So that's the difference, and I think that's why we get results, and that's really where the future of medicine is headed.
I think more medical doctors should be like you. In ENT, I jokingly said off air that we do have some things in common because in allergy therapy, we're injecting something that you're allergic to under the skin or placing it under the tongue. And I find that to be very holistic, and we understand. But as medical doctors, we have a scientific basis for why these holistic therapies work. And so there's a lot of inflammation, a lot of inflammatory diseases out there that are occurring, and they seem to be fairly predominant in women. Why women? That's my opinion anyway.
Well, I think you're absolutely correct. And inflammation is a buzzword for probably the next century in medicine.
I think you're right.
I think we all have to understand it. We have to wrap our heads around it. And as physicians, we have to be assessing it constantly because that is really what's leading to cancer, diabetes, heart disease, everything that you read about today that's costing the nation millions of dollars in healthcare. So inflammation in women is from multiple places. The number one, if we're going to limit the conversation to women, is really from hormones and hormone changes. And what's happening is, as women go into pregnancy, deliver, menopause, perimenopause, all these changes, autoimmune diseases are flaring. But why are, the bigger question is really, why are they flaring more today than they did 50 years ago?
Well, and I think that is the question.
And I have lots of theories about that. And one of the big things that we've seen is a change in our food supply. We've seen a change in our stress levels. We've seen a change in our environmental toxicity. And all of those work together to depress the immune system and trigger more inflammation, which then expresses itself as one of these different things depending on who you are.
And I tell you, I see it in my own life. Again, I've had a little inflammation in the SI joint, and I think I need your help because, what I do as a traditional doc, hey, I think I'll take a little steroid, knock this thing out. One of the worst things I know that I can do, but I feel like I can handle it. So, I'm excited to get into more of this with you. So stay tuned with us here.
Absolutely.
We'll be right back with Dr. Taz, who's the medical director of the Atlanta Center for Holistic and Integrative Medicine. You're listening to Doc Talk with Dr. Jeffrey Gallops on 640 WGST.